Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Inguinal hernia repair. Pediatrics. Introduction. If the muscles of the abdomen become weak, the intestines, along with their first covering, the peritoneum, can push through the weak spot. This feels like a bulge under the skin. A groin or inguinal hernia occurs because of a defect or weakness in the lower part of the abdominal muscles. Your doctor may have recommended a hernia operation for you or your child. This operation is called inguinal hernia repair. The decision whether or not to have this surgery is yours. This program will help teenage children and legal guardians understand better the benefits and risks of this surgery.
Anatomy. The stomach and intestines help digest and absorb the food we eat. The stomach and intestines are inside the abdomen. They are covered and protected by 3 layers. The first layer is a thin membrane called the peritoneum. The second is a wall made of many muscles. The third and last layer is the skin. Symptoms and their causes. If the muscles of the abdomen become weak, the intestines, along with their first covering, the peritoneum, can push through the weak spot. This feels like a bulge under the skin. This is called a hernia. There are 3 types of hernias: umbilical, groin, and incisional. This module explains the treatment of groin hernias. A groin or inguinal hernia occurs because of a defect or weakness in the lower part of the abdominal muscles. The hernia can feel like a bulge in the groin. In males, it can show up as a swelling or enlargement of the scrotum. The weakness in the muscles could be the result of lifting heavy objects. It could also result from gradual weakening of the muscles from continuous stress. Hernias tend to get larger with time. Hernias can be dangerous because some of the structures inside the abdomen, such as the intestines, can get stuck or twisted inside the hernia and cut off their own blood supply. This is known as a strangulated hernia. This type of hernia could lead to the death of that part of the intestine and would require a more complex and riskier operation. Surgery is the only definite way to correct the problem.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Surgical procedure. There are 2 ways to repair groin hernias. One method, known as open hernia repair, uses a skin incision over the area of the hernia. A hernia could alternatively be repaired with scopes and smaller incisions. This is known as laparoscopic hernia repair. The benefits of the laparoscopic operation are a faster recovery period and shorter hospital stay. Unfortunately, not everybody is a candidate for this operation. For example, patients with previous abdominal operations or abdominal adhesions are generally not candidates for this procedure. Sometimes the surgeon can start a laparoscopic operation and end up having to switch to an open surgery. This is usually done if the surgeon realizes that the open surgery is safer for a specific patient. This, however, rarely happens. The open surgery could be performed under local, epidural, spinal, or general anesthesia. The laparoscopic surgery is always done under general anesthesia. Your doctor and anesthesiologist will discuss with you the best suited anesthesia in cases of open surgery. In the open surgery, the surgeon makes an incision in the area of the hernia. The intestines and peritoneum are then pushed back into the abdomen. The muscle wall is then reinforced by suturing it back together. Your surgeon may decide to place a synthetic mesh to cover the defect in children who have reached puberty. The surgeon then closes the incision. With the laparoscopic operation, the abdominal cavity is filled with a special gas. Multiple small incisions are then made and scopes are inserted in the abdominal cavity. The intestines and peritoneum are then pushed back in the abdomen. A mesh is placed to correct the defect. Risks and complications. This surgery is very safe. There are, however, some possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early.
The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. More serious risks of general anesthesia include heart attacks, lung infections, strokes. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they can cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Other risks are common to any type of surgery. These include bleeding, either during or after the operation, infection at the skin level or deeper in the tissue, skin scars.
Other risks and complications are related specifically to this surgery. These, again, are very rare. However, it is important to know about them.
Structures in the abdomen could be damaged. Such problems can include the following. The intestines could be perforated. This means a hole can form in the intestines.
Internal female organs such as the uterus and ovaries could be affected. The kidneys, the urinary bladder, and the connecting tubes could be affected. Damage to these structures could lead to permanent damage and the necessity to proceed with other operations. These, again, are very rare. In extremely rare cases, death may result from these complications. The hernia could happen again or recur. If the patient had a mesh put in during surgery and developed an infection, the doctor might need to have the mesh removed to help clear the infection. In hernias located near the groin, the special tubes, vas, which go from the testicle on the same side of the hernia to the penis, could be injured, which could result in sterility or inability to have children if the other testicle is not functioning. Repairing such an injury may require another operation, which may not be successful. In groin hernias, nerves and blood vessels going to the leg could be injured, leading to some bleeding or decreased sensation on the inside of the thigh. This could be permanent. After the surgery. After the operation is done, the patient is transferred to the recovery room and then to a regular room. Most patients go home the same day of the surgery. Some swelling around the incision and bluish discoloration is normal in groin hernias. This could involve the penis. If the pain or discoloration is very severe, or if you are unable to urinate, you should let your doctor know. To prevent the hernia from coming back, no heavy lifting, bending, or twisting is allowed for a few weeks. Depending on your condition, your doctor will help you decide when you can go back to school and under what restrictions. Make sure to contact your doctor in case of any new symptoms, such as fever, severe abdominal pain, weakness, swelling, or infection.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hernias are a common condition that affect people of all ages. If left untreated, they can cause severe pain and serious complications. Surgery is usually recommended to treat hernias. Hernia surgery is very safe and effective. Risks and complications are very rare. Knowing about them will help you detect and treat them early.
Thank you for using Explain.